Susan Oderwald and Mike Savoie are going to talk to us today, and they'll share a little bit more about kind of what's up and coming, what's happening now, what's up and coming with home care, and some of the fears I think that we have of what might be coming. Well, thank you. Yeah, change, little chaos. I call them chaos. So thank you.
Hey, good morning, everyone. So again, I'm Susan Oderwald and Mike Savoie. Just by way of a little introduction, Mike and I have both been pretty involved over the past, I guess, year or so, maybe longer, but especially in the past 6 months to a year, and working closely with the Connecticut chapter of the Home Care Association of America, because there's a lot of different things going on with our industry at the national level, and a lot of, I think, I'm going to use the word reckoning going on here at the state level as well. And so we're seeing some changes introduced legislatively. There's a lot of industry trends going on. And I thought it would be a good topic to just talk amongst ourselves a little bit about what home care, non-medical home care really is, what it isn't, why it's important, and all of these different types of trends and things happening both locally here in Connecticut, but also nationally, that are really reshaping the industry. I think I said last time, almost all of us at some point in our lives, whether it's for ourselves or our parents or another loved one, has to curate or deal with helping people through advanced aging and the end of life, or other situations that would require them to receive care at home, custodial care at home. So and of course, usually, or not usually, but I'd say 80%, 70 or 80% of the time, you guys, and there's plenty of other home care agencies, we meet people in the midst of a crisis, right? We're meeting people who finally have had to be forced to look into home care and to other options for mom or dad or themselves because they just can't manage alone at home. And of course, that's not the most optimal time to be completely educated about how this works and how it fits and how it's paid for and all those good things. So we're going to cover, I think, quite a bit, a little bit this morning about what's happening in Connecticut and legislatively in some context. And then we'll talk, I think at the end, we'll have a few slides just a little more generally about what non-medical home care is, what some of the constraints are, and some of the things that if you need non-medical home care, you need to be thinking about or asking as you're going out to secure those services. Want to say anything?
No, you said it. You said it all. I mean, I certainly have a lot to say and probably not enough time to take 5% of it, but Susan, that was a great introduction, and perhaps maybe we should just go into slides and we can take it from there. And I can give a little background of the industry to begin with, so you have a better understanding of where we're coming from.
Well, just move the on the other screen. Move it on the main screen.
Oh, on this, sorry.
Yeah, just move it over to the side.
We felt like we wanted to start with this because even though it does seem a little fearful and doom and gloom. I mean, 90% of the agencies in our industry are great, you know, provide quality home care, but there are some bad players out there for so many reasons and variables. And when I was on the task force for 5 months, I did hear a lot of testimonials from people who have had major issues with their home care providers. And we wanted to lead off, like I said, strike a chord with these are just 4 of the stories that we heard and what happens at times. And they're very hard to believe because the majority of stories that I heard were from very reputable, well-branded agencies. It wasn't like the mom and pop agencies, because that's another issue where a lot of agencies are literally run out of living rooms, and a lot of don't understand the statutes and so on and so forth. So we wanted to begin with this just for you to understand how important this is, what we do.
Yeah, I think probably everybody's heard of this horror story, right? Has anybody not heard a horror story about home care? Probably not, hopefully this bad, but even just difficulty in provision of care and stuff.
Okay, there's there are a lot of concerns in the industry, and I just wanted to give you a little background. Probably the top priority, the main concerns are the lack of funding first and foremost, and resources by the state of Connecticut, the lack of clarity and so much confusion within the industry, not only confusion on the part of the public, but a lot of confusion with the actual home care agencies ourselves, because there's not a lot of guidance and especially oversight. That's third and maybe the most critical issue we're facing right now. But to give you a little background of our industry, before 2006, there was no oversight in Connecticut. There were no regulations. So, and there were a lot of agencies out there, but in 2006, we became regulated under the Department of Consumer Protection. We get certificates, so we meet certain standards of criteria. We are not licensed like you would be in the Department of Public Health. So in 2006 is where it all began. And in 2006, the Senate, the General Assembly came up with 4.5 pages of statutes, regulations, that kind of regulations we abide by in the industry. And since 2006, believe it or not, these 4.5 pages of statutes have never been edited, never been revised, and there have been no additions. So I think it's time for a change, and this is without question the most critical part of our industry. So moving forward.
Yeah, so, yeah, I think the only other thing that these slides, points out is, in Connecticut, which is honestly a bit aberrant from most other states. Mike and I are both part of franchises. I get exposure to lots of other owners around the country. But we have a very low barrier to entry. Pretty much anybody who's a registered legal company, LLC, S Corp, doesn't matter, can pay their annual registration fee or register for about less than $400. There are now a few boxes you have to check relative to bonding and insurance that weren't there before, and there's some information you have to provide, but very, very low barrier of entry. And as to Mike's point, there's really no dedicated staff at the Department of Consumer Protection that takes a look at our industry and does any type of enforcement, meaningful enforcement.
Yeah.
You have this nice first bullet, so yeah.
So I've always said from day one, the first, when I first got into this industry back in 2014, Connecticut's motto should be quantity over quality. We're known, and I could get a little in depth, but we're known as homemaker and companion agencies, and I have an issue first and foremost with that, the title of our industry, but in saying that, we currently have about 915 agencies that have certificates now. In the last 10 years, it went from 308 certificates to about 915 now. So it's massive, massive growth. And this is a top priority issue simply because, like Susan said, the Department of Consumer Protection oversees us. They lack the funding, they lack the resources, but they lack the manpower. And they literally have 5 people that oversee our industry and 2 supervisors on the road. So in essence, what's happening is if you have over 900 agencies throughout the state, it has become, and the phrase has been used more often than not, sadly, the Wild West out there, because a lot of agencies are willing to take gambles and risks and do things that are perhaps unethical, immoral, unlawful, just to keep cases, so on and so forth. So in my opinion, the biggest issue with all, somehow, some way, we have to, the criteria for registering for a certificate in Connecticut, we need much, much more stringent regulations. And I just wanted to add that every single state in the country, the laws are different. Some states don't even have oversight, and that's a fact. Most of the agencies in other states are under the guidance of the Department of Public Health. I also wanted to add this, and I brought this up at our Zoom meetings on the task force, that probably the 2 most regulated states in the country, and it is so important to use those states as models, are Rhode Island even though it's a small state, it only has 60 agencies. So without question, they stress quality over quantity. And one of their criteria, which I think is very important, could probably be useful in Connecticut, is anyone who applies for a license or registration in Rhode Island has to wait 1 year before they're able to open up. So this may inhibit or people from just quote unquote buying a certificate in Connecticut, because like Susan said, $385. Anyone in this room could purchase a
Registration.
You get a registration and you're in the club, you own a home care agency, believe it or not, with no training. It's mind boggling. And the other state, I mentioned Rhode Island, is New Jersey. In 2019, they became the first state in the country, and only state in the country to the state, that requires accreditation. So I think that helps tremendously.
And yeah, I just want to add, I mean, there are national bodies that provide accreditations and other types of training and certificates. Obviously franchise systems operate, with training and pre-qualify owners and things like that. But, to Mike's point, there are a lot of other states, places like Texas and Florida and Alabama, that honestly have greater barriers to enter into the industry than Connecticut does.
Some states are, might take a few months, but 1 year, what do they have, what do they have you doing in that year?
I want to, believe it or not, my workers' comp bank informed me this. And I've been talking to some people and they said, yeah, it's true, because I didn't realize, because when you try to do your research and homework and get out to the internet, it's so hard to access information. I think that's one issue that Connecticut has also, because even we have issues sometimes with getting answers, because if we ask 3 or 4 people in the industry a question, we usually get 3 or 4 different answers. But in saying that, I'm looking more and more into it and how Rhode Island works, because I do want to bring it up to certain people in our industry, especially our home care lobbyists and the home care association.
And I do think there's some states like New York, for example, when I was initially 10 years ago, they weren't issuing licenses. And the reason is exactly what we said on this slide is they want to make sure that they're resourced to oversee them.
That's right.
So if they have 500 companies and they know that's the max that they can oversee at the Department of Public Health, they're gonna put a moratorium on licenses until there's room, and they take waiting lists, and you have to wait basically until there's an opening. That is a big constraint on the barrier to entry, obviously, but the whole point is we're not gonna let agencies operate if we can't oversee them, if we can't audit them, oversee them, what have you. Some states do have audits, just like nursing homes have annual audits and what have you. But we don't have any of that here in Connecticut. And the result is we have a lot of agencies and no oversight.
We do
No
have,
effective oversight.
we do have audits, but they schedule, I believe, 4 a month, a year, I'm positive. 4 a month, maybe something like that. So if there's over 900 agencies, that's not too many audits. And also they have surprise audits, but very, very few, because they're simply overwhelmed in so many other capacities.
Yeah, so we got like, why are you guys doing it? Yeah.
Yeah, only 2 people, that's a fact. The second was added about 3 years ago.
So why don't you talk a little bit about the task force? This slide talks about, I think Connecticut recognizes that this is a problem. And they created a legislative task force last fall, right? Yeah, that Mike participated on as an industry representative. And had participation from lots of different groups. I'm gonna let Mike talk a little bit about that. And then as a result of that, as well as other initiatives by the Department of Consumer Protection, there's a couple of pieces of legislation right now that are working through the Assembly, the Connecticut State Assembly, that start to introduce some changes to the industry and some greater regulation. So I'm gonna let Mike talk a little bit about the task force.
Yeah, there's, over time, it's just, has been getting worse and worse, and without question, to me, it's because there's the lack of oversight for many agencies. But anyway, there was one lady who I become very close with, she worked with a very reputable, agency, but unfortunately, they committed many serious violations and they were never really addressed, and she had issues and the aides were leaving the home and leaving her father alone, and they basically, sadly, unfortunately, led to her father's demise and death. So she reached out to a senator, her name is Billie Jean Miller, and she was the one that really got the ball rolling. And so the Senator Billie Jean Miller requested that a state task force be assembled, and different people in government were allowed one appointee each to become members of this task force. 12 members in all, but only 11 participated because one guy just never showed up. I don't know. So starting in September, we met for 5 months, usually 2 to 4 hours each time, and we just discussed every single aspect of the industry. And there was a lot of people on that task force. As far as I was very impressed from the head of the Connecticut Healthcare Home Association, our Alzheimer's Association. There's only 3 home care agencies. There was a lot of input and a lot of great stuff, and we made, finally, when it was all said and done in January, we submitted a 26-page report to the General Assembly, the aging.
The Committee on Aging.
Committee on
not
Aging,
Agency
yeah.
on Aging, that's a typo.
Yeah,
I'll fix that. It's Committee on Aging.
and they absorbed it all, and to much to my surprise and delight, they passed this bill, SB House Bill, Senate Bill 1025, and it is moving along with not enough revisions, and it can still be revised, but the more they prioritize some recommendations. So first and foremost being that we are going to be transitioning to the Department of Public Health. Where that goes, and it is moving along, and it looks like it's going to be passed, but it's just once that we'll cross that road once we face it, because I'm not sure what's going to happen after that, but that's definitely a step in the right direction. So that's really where we stand right now.
And then the second bill that's moving through the process up there is HB 6767. That actually goes through the General Law Committee, which really is, I would say, supposed to be more of an administrative committee on how agencies function. So the Department of, I say agency, governmental agency. So the Department of Consumer Protection in this case, there's 2 sections in this bill, which has probably 150 sections that deal with home care and the Department of Consumer Protection's ability to oversee, hold hearings, criteria for removing somebody who's been in violation. There's a requirement that owners will have to pass background checks. There's a requirement, there's several requirements, most of which and both of these bills have largely harmonious requirements on how we communicate with clients, what kind of notices we give to clients about ends of services, how we communicate with the Department of Consumer Protection or eventually the Department of Public Health about whether we're ceasing operations or ceasing service for a client. So there's a number of things. Contractual requirements, training requirements. There's a number of things in both these bills that are largely harmonious with each other. They're not in conflict with each other, which is good. That really give the Department of Consumer Protection more teeth to remove bad actors, is the way I like to say it. And the Connecticut chapter of the Home Care Association of America is largely supportive of both these bills. Completely supportive of 1025 as it came out of committee. But the Department of Consumer Protection came back and has tried to is looking at amendments. Those are being negotiated right now. But I think we probably have a solution there that they don't like and that we don't love, and so therefore it's probably a good solution.
Yeah.
So 1025 is definitely, I think, going to pass. I don't think there's much opposition on either side for that. And 67, this is 2 provisions that are sort of buried in the middle, but largely They're constructive things. There's a couple of little tiny things in there that are being negotiated. Maybe one amendment there we'll go through, but I think both of these bills are the first legislative changes since what, for an awfully long time in an industry that has completely changed over that same time period. So I think most of us who are kind of watching this stuff are doing a lot of what's in there already and welcome these changes and welcome the department's ability to ride herd on some of those things a little bit more stringent. Is that fair?
Thank God this is happening and there is more awareness now because without the Home Care Association of America and a Connecticut state chapter and people like Susan and others in the industry, I have to say, because the more I've gotten involved, I have a further understanding because the senators and the people up in Hartford, they are absolutely positively clueless as to what our industry is about. And that's why we're probably where we're at. We have to bring their attention to this and provide them as much information as possible. Because I was literally up there the week before last, and I got a meeting with two senators, Senator Kelly and Senator Manera, and I was with Matthew Hollisey, who's knows him very well and been working with him. And he is the home care lobbyist and he's an attorney. But I was astounded because it was first of all so hectic because they were in session. And when we were speaking to the senators, we had about a half hour with them, which I could tell when I was saying and what Matthew was saying, they were only listening with one ear because they were just like, and they were like, what's this? What's that? What's this? And I was like, oh my God, so, but slowly but surely, overall, we're having an impact and that's a great thing.
I think one of those chapter meetings we went to near like Rocky Hill, they showed the national politicians, the leadership, like, look, all these people are old. Biden, Pelosi, and so they're gonna, hopefully they're gonna be seeing it themselves, but then also I would imagine in our legislature, they're dealing with their own parents, and so whatever we can do to relate to them, give an example of help the better understand what we do, right, and what the issues are.
Yeah, and talking to my reps, I live in Newtown, so I vote in Newtown. My business is down in Milford, so I've been talking to all of those pieces. And all of them have personal stories or usually close to the chest stories. And there have been a lot of initiatives on the national level, including one yesterday. Biden just signed a $150 billion executive order over 10 years. So that's what, $150 million a year to support family and in-home caregivers. So there is a lot happening at the national level, a lot happening with the VA, which touches our industry quite a bit. So there is a lot going on there. I thought we'd just cover a little bit of clarification about what non-medical home care is. I like the term non-medical home care because it's unambiguous, which is harder to say than non-medical. And it's generally the vernacular that's used in the industry nationally. And I would love for us to get away from calling things weird here in Connecticut and being part of the same vernacular. But we, as Mike said before, we refer to it here as companions and homemaker services. It is not healthcare. We don't recommend treatments. We don't give medical advice. We can't manage medications. We can't do anything invasive. We're not allowed in our advertising, our brochures, and in our discussions to make claims that we have any expertise in any disease category. That's guidance directly from the Department of Consumer Protection. So I can't say that, even if it's true that I provide training for my caregivers in Alzheimer's or dementia care, I'm not allowed to put that in my brochure because it relates to the consumer that somehow I have an expertise in dementia care and I'm not a medical provider and I can't do that. So you see a lot of in the brochures, this general language, which I think somewhat contributes to customer confusion because it's vague and innuendoed. But that's the reason why. Obviously, we can't give injections. Nail salons, hairdressers, they are all licensed through the Department of Public Health. I think the Department of Consumer Protection is not wrong that if you're under us, you do not touch people. And that's sort of been their hang up about how to regulate us and how to do things, because clearly we have to touch people. If we're going to help them, toilets, and if we're gonna help them with other things. So, we're not allowed to do anything invasive. There's gray areas, about, the use of equipment, colostomy bags. I mean, there's a lot of gray areas where if you ask the Department of Consumer Protection, they would say absolutely not. But the reality on the ground is if we can't do it, who's gonna do it? I mean, honestly, who's gonna do it? So, that's, I think, a lot of the confusion that Mike was alluding to earlier, that even amongst our own industry, if you ask, are we allowed to do this? And you ask 3 different people, you'll get 3 different answers. What we can do, or we're supposed to do, is really assistance supervision for a safe and clean environment and to ensure, in the statute, there is this word personal hygiene. Obviously, you want people to be safe and clean. I think that was the intent of the original language. Personal hygiene is the phrase that they use in there. We're mostly working, obviously, with older special needs adults. Some agencies, not all, do errands, doctor's appointments, grocery shoppings. We have hourly care, we have live-in, permanent or temporary assignments, respite care, all those things providing additional help in the home. But I think it's important that everybody understand that while I may only hire trained caregivers, or I may provide training to my caregivers, there's no requirement at the state level that people train their caregivers or that their caregivers receive any training. And I know agencies that recruit at Dunkin' Donuts. Right? I mean, there are staff shortages, there's a lot of staff pressure, it's hard to find good people. So the training element, the oversight element, those are all things that really differentiate agencies. But it really is a sort of a buyer beware market. You have to know what questions to ask. You have to, understand that not every agency is going to have the minimum threshold that I think most consumers would assume is there.
Yes.
Mhm.
So would the question be, this is scaring me, and I've used you guys for years. And because I felt confident with you all when I met you, but the question is, if I were a consumer, or I'm trying to tell one of my patients' families that they want to hire a company such as yours, what is the question to ask that agency in order to feel more comfortable? Like, should you ask them, what is the training that your caregivers have had, or what do you provide? Like,
Yeah, I was thinking the same thing, because if you're hiring from Dunkin' Donuts, they're gonna say, oh, yes, they've been trained.
I'm just saying.
and- No, I'm just saying,
Sorry, I heard that.
No, but at the same token, like.
I mean, usually the question is like, so who are your employees? Like, what is their?
where they come, what's their background?
What's their background?
They have multiple backgrounds doing many things. Just elaborate.
I think it's about the training and what
So-
to do as an orientation.
So I think the question is how are your caregivers, I call them caregivers, aides, there's again a million names for them.
Right.
How are your caregivers trained? Are they your employees?
Right.
There are agencies out there that treat employees as 1099 workers when that is actually illegal.
Registry.
Right, that's a labor law issue, not one of these issues. That's a labor law issue.
But they're still up there.
But they're out there. But they're absolutely out there. So, how,
Then there's not the accountability.
absolutely,
No.
there's not. And of course, there's just a sort of an underground market of hiring directly, which is absolutely going to be a less expensive alternative. And people may have good luck there if they're high functioning people who can screen people and qualify and run their own background checks. But the danger of that, of course, is if you hire someone directly off the street, first of all, there's not a village helping you. So if something happens to that person, you're left stranded. But you really have to know who you're dealing with in those cases. And honestly, a lot of the horror stories that you read in the paper are not agency employed caregivers. A lot of those stories that come out in the press are people who hired off of caring.com or Craigslist or one of those other, or a friend of a friend of a friend, and ended up in trouble.
Here, I like this spot on that. You have to ask a lot of questions. It's the answers you get from agencies that will provide the families with peace of mind and clarity and the trust factor, so on and so forth, because there is so much gray area and there is so much confusion, and from day one, again, our industry is called homemakers and companions, and it shouldn't be, because, and we are the only state in the country that recognizes that, because 90% of our cases probably are personal care cases. So that's why I thought first and foremost, there should be a need for a title change, like Susan mentioned, to non-medical home care agencies or home care, homemaker companion agencies. So that'll alleviate some of the confusion. So I also mentioned that in our statutes now, it just defines homemakers and companions. And how it stands now, literally, is if somebody calls up and say the mom suffered some dementia, or they took a severe fall, they require bathing, and so on and so forth. So many personal activities of daily living, actually. I could call up, we wouldn't, my mom, if she was on our roster, and say, Mom, you gotta go take care of this person, which would be very, very scary. But the fact of the matter is, like I said, we provide personal care services. The fact of the matter is, and I'm sure Neil Rose and Susan can agree with me, is 80% of our aides have home health aid licenses. Well, they're not licensed, but they're certified home health aides.
CNA training. Yes.
And I actually went through this process myself also because I wanted a further understanding. And what that is they're required to go through in Connecticut 100 hours of training, 50 hours of classroom, 50 hours of clinical. And the only difference between a home health aide and a CNA is that the home health aide, after receiving the certificate, decides to take the one-day state exam and becomes CNAs, and then they're allowed to go into nursing homes, hospitals. They're required. They have to be CNAs to work there. So I beg them to put into this SB 1025 to include personal care services, because as it stands right now, we're just according to the DCP. I was one of the unlucky ones to be audited. I had a random audit, and they were at my office for 7 hours maybe, and what I heard, I couldn't believe, and I won't mention his name, but the gentleman there, and I welcomed them with open arms, but what I heard so dismayed me, because the whole time he called us, he kept saying to me, and I'll never forget it, you guys just do the dishes in the laundry. And I was so offended by that. Yeah, I could add a lot more to that. So the bottom line is, our caregivers are certified, the majority of them, they are trained, and like our caregivers, I'm sure yours too, have probably 8, 9, 10 years worth of experience. And when a potential customer calls up, we'll take all the information, plan a care assessment, so on and so forth, and then we'll find a compatible caregiver to go out and help that client.
Mm-hmm. Yeah, absolutely. So training is a big question to ask. Qualification of caregivers is a big question to ask. This slide just kind of puts in context what we do. So obviously people are familiar with medical care, doctors, hospital, skilled nursing facilities, rehab centers, testing facilities, outpatient surgical centers, walk-in clinics, all of that, clearly falls under the medical industry. It's covered by medical insurance. When you start to move home, you are followed home. Usually you have to have a prescription to be followed home, usually by a home health agency. And this is part of the confusion. Home health agency versus home care agency, right? For the average person not in the midst of that, that is splitting hairs and hard to, you're not going to make a distinction. And I think honestly, that's part of DCP's, agenda with this. So home health, includes services at home, nursing, physical therapy, occupational therapy, social work, speech pathology, hospice services at home are considered home health. And there's a few other things, social work, I have social work. So these require usually a doctor's prescription if they're going to be covered under medical insurance. They're usually part of some kind of recovery. They are not usually part of any type of ongoing custodial maintenance program usually. And generally speaking, in that context, they're covered by Medicare or someone's medical insurance if you're younger than Medicare. And then we have, see all these names, custodial care, non-medical home care, companion care, personal care assistant, homemakers. All these terms basically refer to this non-medical home care branch. And insurances don't pay for that. Long-term care insurance, if you have it, will pay for that, but medical insurance, generally speaking, does not pay for that. There are some Medicare Advantage programs that can include some hours of home care. There was one provider of those plans here in Connecticut. They stopped providing that as of January this year. So to my knowledge, there's not one Medicare Advantage plan in Connecticut, not in other states, yes, but in Connecticut, no, that is currently providing hours for non-medical home care. And so, it's mostly private pay. I would say 60 to 80% of my clients are private pay. I do a lot of VA work. The VA has a couple of excellent programs to provide home care. And then of course there's Medicaid, state-run Medicaid programs that agencies can tap into. I don't personally participate in that because the reimbursement rate is too low. And I would lose money on every hour I provide. And that's another thing we're lobbying for is increased monies to support care fund for Medicaid as well, because I would love to do that work. I just can't afford to do that work right now. I don't know how you feel about that one. Agreed. So just leaving the nitty-gritty for a second, there's other industry trends that have nothing to do with the state of Connecticut that are going on, but are certainly happening here. Medicare reimbursements, COVID, labor shortages, obviously the demographic shifts that we're seeing of people living longer are all increasing demand for home care, for both home health care at home, but also non-medical support at home. Basically, the medical system is doing everything it can to structure itself in a way that keeps you out of the hospital, out of nursing homes, out of those high-cost centers, and puts you into low-cost centers. And I want everybody to think about that for a second. One of the reasons they're a high-cost center is because the insurances and everything else are paying for the non-medical piece of it, right? The aide in the room who's helping with bathing and dressing, all things. If they're able to offload that at home, suddenly that's not on their books anymore. And now it's a private pay concern. So there's sort of this structural thing to reduce cost under the medical piece and shove it into the non-medical piece. It doesn't reduce cost. It just shifts the burden of cost from insurance companies to private people. There's also a ton of, because of these trends, there's a ton of technologies being introduced for remote care. This goes far beyond telehealth. This goes to fairly increasingly mind-boggling, sophisticated health monitoring systems at home. We did a presentation last year on one relative to tracking effluent from the body, a toilet-based one. Our franchise is using an AI listening device that will listen for anything aberrant it recognizes a baseline and then listens for anything aberrant in the household to see if somebody needs help or if there's something wrong going on, including raised voices of caregivers and things that might be abusive of care, of care going on in the home. But there's all kinds of technologies flooding the market right now around home health. Again, here in Connecticut, we have way too many non-medical home care providers, but I think in general, that's true around the country as well. We are seeing consolidation. I think everybody knows the largest companion and homemaker agency, Companions and Homemakers, here in Connecticut was bought last year. And they split it in two. They split out the Medicaid business and the private pay business. One of them was bought by a company out of Georgia, I believe. Which is a big national company, right? So there's a lot of consolidation, nationalization going on that's just part of, there's too many providers. We need to find better economies of scale. And then I think it's important to recognize that large healthcare players are now moving into non-medical home care. So Yale offers, in direct competition to me, they offer non-medical home care services adjacent to their home health services. Hartford Health does. Walmart has talked about this. CVS is starting to look into home health and non-medical home care options. Amazon has talked about it. So there's a lot of large, because it's such a large, attractive market has all the trends going in the right directions, and honestly has so much opportunity for efficiency.
Well, it's gonna grow too, because they don't want
And-
anybody in nursing
yeah, and-
homes, so
yeah.
you're gonna get the business that they're not gonna send to me anymore.
Yeah, yes, yeah.
Or they aren't sending to me
Yeah.
anymore.
Right.
You're gonna get the cases that absolutely have to be there.
Before
At the
Everybody
same
else.
time, we're being limited on.
Right, so we're seeing,
Yeah.
we're seeing people with higher medical needs at home. And we're in Connecticut so far behind this notion, instead of requiring training so that we can actually help people at home, they're saying you can't touch them.
Right.
So
It doesn't make sense.
The two trends, are really going in opposite directions and creating honestly a lot of problems on the ground for people.
Susan, I'm just giving you
Yep.
time. Jeff.
Yep. We're almost done. So again, to your question, key elements of successful home care, stable, predictable schedules. It's not an on-call service. I want one person taking care of mom. I'm on here for 2 hours on Monday in the morning and 5 hours in the afternoon on Thursday. And if there is a labor shortage, you need to make your attractive schedule to keep your schedule attractive to caregivers, especially if you want to limit the number of caregivers that are going to be coming in and out of your house, which I'd say generally speaking is a good idea. And again, appropriate conditions at home, caregivers, I will not send my caregiver into a home that is unsafe, has firearms laying around, has aggressive dogs, has a drug-using nephew living in the basement, you name it. The environment for care has to be safe for mom or dad. It also has to be safe for the caregiver. Obviously treating caregivers with professional. And asking the same, I mean, there has to be some, I know everybody wants a best friend to come in and take care of mom. The truth is you want a professional coming in to take care of mom. You want there to be some boundaries. You don't want things to become too personal in the home, which when you're providing care in this context, compassionate, loving care in this context, easily can happen. So you want some professional lines and professional boundaries. You want people who are kinder and compassionate, but if things are too familiar, that's a red flag for you that you need to address. And finally, I have to say, you have to be prepared for what it costs. It's expensive and it may not be the least expensive option. I always run into home care's gotta be less expensive than assisted living. It's not always less expensive. I mean, really, it's not always, yeah. It's really not always less expensive than assisted living. So you need to kind of know what your options are. You need to use your home care appropriate. I put this in, you don't want to go with the low bidder for mom, right? That's, you need to shop it around, but if somebody's price is $3 or $4 or $5 below what everybody else's price is, that's not a good thing.
Yeah, what you pay for.
Yeah, that's not a green flag, right? So you really have to, inquire why that is, to be comfortable using those people. So, for the time being, shop it. Don't give out your personal information and your mom's personal information on the internet. That's a whole other area of, oh my God, that we don't want to, get into. Ask questions and make them explain anything you don't understand. There's a lot of vernacular. There's a lot of ins and outs of how the business can work successfully. Make them explain that to you. And this is just basically a summary of what we've been talking about. I don't need to read through them.
Susan, can I just add to that, putting your loved one's information out onto those sites like caring.com, a place for mom, it adds so much stress to an already stressful situation for the family that if anyone is, if you can talk to your loved ones to avoid that at all costs, it just adds so much unnecessary stress, because what happens is they fill it out and then they start getting calls and calls and calls and they don't stop. They don't stop. Some companies are relentless and, again, it's like, it's just making the situation even more worse.
And even with assisted living, I would go on one night at 2 a.m. because I'm out of my mind with my mom, and I give my information to 5 local assisted livings, and then the next, year of my life is living hell because they're all calling and they're all hounding and, mom's died and I'm still getting the calls and, it's tough. It can be to your point exactly. Any other questions or
They
comments?
have questions on it.
Yeah, let's do that.
I know we've been asking a bunch.
Is there any oversight for background checks? Like, is that a
It
requirement?
is now a requirement for us to run background checks upon hire.
Okay.
I personally run background checks every year on every caregiver, and as I said, they're gonna be introducing background checks for owners.
But it's required, that doesn't mean people are doing it.
That's right.
Okay. Mhm.
Well, yeah, I mean, it's the law, so if they're not doing that, they really are out of
We'll have to get
compliance.
a-
They get audited.
Yeah, if they get audited, they'll be doing big side.
People don't also realize that as far as background checks go, you work with obviously a reputable agency, but there's like, the one we work with was at 5 different background checks.
Yeah.
And, you know, you can go for the $19 one, or you can go for the $68 one,
Right.
which is, you know, a lot of.
Yeah,
Right.
yeah.
Does anybody online have any questions?
Yes, I do. And I'm sorry if this was already talked about because I got interrupted a couple times and had to step out. But I'm hearing rumors that care is going to be taken out of home care. Is that true?
So there's guidance from the Department of Consumer Protection that is not allowing us to use the word care in our promotional messaging, literature, and everything
So
else.
you can't be called a care agency.
I can't be called always best care.
They did back up on that. They did back off on that,
Hold
but
on,
it was,
that's
it was a
what they,
serious, like,
yeah, that's what they want. This legislation and some of the amendments that are passing through are clarifying and backing off some of that. According to the Department of Consumer Protection, that guidance is on the books and still exists, but they're not, no one's enforcing it right
They're
now.
the only ones fighting it, the PCP, the only ones.
PCP wants it.
They're, yeah.
So it is getting fought, it is being fought at this time? They are fighting.
Yes, it is being fought at this time. The legislation partially addresses it. I think there's probably gonna come out of that, meat grinder, some compromise language. But, it's not gone and it's not gonna get
What is
gone.
the thought behind it? That you're not care?
The care insinuates medical care, and therefore we are insinuating that we provide medical care.
According to.
if you
According
look,
to the Department of Consumer
Yeah,
Protection.
that's it.
Okay.
but if you look it up in the dictionary, there's like 3 definitions, and one of them applies medical, the others don't, like your assistants.
Can they focus on the things that matter?
In the slides for exactly that reason. It's a rabbit hole. It's a distraction. With all the things we've talked about in this presentation, if that's what they're focused on,
Yeah.
that's, I mean, that,
joke.
it's silly.
Well,
It's
that's
just-
the stuff that they pass easily and say, well, we addressed these 5 things.
Well,
Right.
this is all happening within the department's guidance. It's
Yeah.
not happening at the legislative level. Legislators are generally supportive of our position. But it's not a done deal yet. It's not gone away yet, and I'm not sure it'll go away completely. Good question. Any other questions from the floor? All right.
Susan, you know how we have nursing home compare for nursing homes, and I know they have it for other entities. Do they have it for your entity?
No. No. There's nothing,
Well, there's nothing.
there's nothing on
rated
Medicare or in any of those
Which makes sense.
about us at all.
Because
And
they're private.
I'm gonna go so far as, I had naively earlier in my tenure as an owner, I had a real disturbing issue with the caregiver, and I called to report it.
Mhm.
And they laughed at me, they're like, we don't take any reports on,
Because they're not like.
on a certified nurse's assistant. We don't take any reports on CNAs, we can hardly keep tracks of doctors. So when I go and look up somebody to verify that they have a CNA license, and it says no findings, that little no findings is completely meaningless.
Okay.
So that's how bad it
It's
is.
funding and resources. If we transition to DPH, it's still gotta come down to properly being funded.
So, so my job is basically randomly going to houses, checking on making sure that.
Yep.
Caregivers doing
Home
their
care
job.
supervisor.
Right. So I have to write a report every time I go to a house.
Yes.
Now, when I give that report to the owner, and if that owner has to do some action more severe, then what are they gonna do? What's she supposed to do? You know what I'm saying? Like, so,
What recourse they
yeah,
have?
like what reports is there? Like,
This will protect the
so I have to write a
services.
report, and the owner checks the, listen, look at the report.
Right,
So if
if the owner ignores a dangerous
the
situation,
owner doesn't want to ignore it, but they feel like they should go further.
there's very little.
So you fire them.
Yeah, you have,
Other than,
yeah,
but
clearly you.
what happens if you fire the caregiver,
And
but
it's-
you wanted to go?
Yeah, no,
Well, I would still call, even though she's
Yeah, I-
telling you not to report it, I would still call and document that you reported it, because then they'll say, well, what did you do about the situation?
yes, yeah,
We're obligated reporters.
yes.
Protective services as well.
Yes, and
Contact
if, yeah, if there's something really going on, when you can, you know, especially if it's a family thing,
Right.
yeah, we're an obligated reporter as
Mandated
well,
reporters.
mandated reporters as well. But yeah, I mean, we can, we do report them, but I'm saying, and I won't renew their licenses, and you know, you get all these weird requests from people, you know, you're like, are you kidding me?
Yeah.
But, you know, I'm just saying that even the things that you think are above board and would qualify for good care don't necessarily mean what you think they mean, so.
More important to join something like the chamber, to network with your people, to get to know the type of businesses we all have, so we can trust each other, because
And
I have to
listen,
tell
it's
you,
a
when
tough
I
business.
see caregivers from your group or your group, I'm like, oh, thank God, you know, honestly, because we don't know what we're getting when we get another agency in.
right.
And we're always like, on, you know, watching extra, just because we don't know them and they're not as accountable, you know, because it's you guys who really make the,
So Susan, like Always Best Care, you do it in Milford. I know there's an Always Best Care in Wallingford.
Correct,
Do they have the same requirements that you have
yes.
versus willy-nilly?
So Always Best Care has minimal requirements for things like training, insurance, and there's some under basic things. If you, I mean, and then we have 6 offices here in Connecticut, they're all independently owned and operated. I will say our little 6 group is, we meet monthly, we talk to each other all the time, we share resources, we share advice, you know. We do things pretty much, we share actually policies, procedures, because, you know, if I've written a policy or procedure about that, you know, nobody wants to reinvent the wheel. So yeah, there's a lot of I can speak just for my franchise. There's a lot
I
of
understand that, but at
communication.
least for your franchise.
And I would say most franchises, they've qualified you as an owner, they've probably done some training, there's some oversight there. There's a mechanism for complaints to the franchise. So most, if franchised operations have something above and beyond from an oversight perspective, but that doesn't necessarily mean they're better. I'm not saying. there's a lot of
I'm not
great-
saying they're
Yeah,
better
there's
or
a lot of
not.
great privately owned agencies out there that are very buttoned up as well.
Right.
So
I mean,
it
Mike's
is
a
about
privately owned agency, but yet we
We're
trust.
franchise.
Oh, I didn't know that.
We're a smaller franchise and we're the only one in Connecticut though.
Rose is a franchise, right? Yeah.
Yeah, big time.
There's 7 of us in Connecticut.
Yeah, you're a franchise. Are you a franchise?
4 of us.
Are you? What's your name?
No.
You're not franchise stuff. Yeah. So it doesn't necessarily, you know, mean one thing or the other, but it's really up to the consumer to know.
And a lot of things come from corporate too, that you have
Yeah,
to,
you have to do.
rules and regulations.
Thank you, everybody.